Hi, I'm Dr. Hansen. In this video, I'm going to talk about how to avoid asthma triggers. One of the best ways to identify asthma triggers is to pay attention to when the asthma symptoms occur. For example, if symptoms occur when indoors, then something in that environment might be the trigger, such as house dust. If symptoms occur in the spring, then pollen might be to blame. Blood tests or skin tests can sometimes determine if a person is allergic to a specific substance. Once asthma triggers have been identified, the person can avoid the trigger as much as possible. If exposure to a trigger can be predicted, then one can consult with a healthcare provider about taking an extra dose of medication such as albuterol before exposure to that trigger. Immunotherapy, also known as allergy shots, can be helpful for allergic triggers. Allergens are substances that can trigger symptoms in people with asthma. The most common indoor allergens that affect asthmatics include dust mites, cockroaches, mold, animal danders such as skin, fur, feathers, saliva, mice droppings. Dust mites are microscopic organisms that are present in most households. They live in bedding, sofas, carpet, any woven material where there is humidity. To limit exposure to dust mites, one can cover pillows and mattresses with plastic or other impermeable fabric covers designed for this purpose. Also, you can wash bedding and pillows with warm water and detergent and/or drying them in an electric dryer once a week. Minimize the number of carpets in the household and minimize the number of stuffed toys in the child's bedroom and wash them weekly. Now, mites thrive in humid conditions, so opening windows in dry climates and using air conditioning in humid climates decreases the humidity in the home and therefore reduces the number of mites. Upper floors tend to be less humid than lower floors or basements. Household humidity ideally should be between 30 and 50%. Humidity monitors can be purchased at most hardware stores. Mold spores can trigger symptoms of allergic rhinitis in some people. These symptoms include nasal congestion, runny nose, sneezing, itchy, watery eyes. Mold thrives in damp environments such as air conditioning vents, shower stalls, leaky sinks, damp basements, and refrigerator drip trays. These areas should be cleaned regularly. It's also important to decrease humidity, which can also be accomplished by removing sources of standing water and persistent dampness. This includes fixing leaky plumbing, correcting sinks and showers that don't drain properly, removing bathroom carpeting that is exposed to steam and moisture, also removing houseplants and dehumidifying damp areas to levels less than 50%. Indoor trash cans should be regularly disinfected and the dehumidifier should be used in basements. Old books, newspapers, clothes, and sheets should not be stored in the home. Water-damaged carpets should be thrown out. Sinks, tubs, tiles, and other surfaces with visible mold on them should be cleaned at least every 4 weeks with dilute bleach. To dilute the bleach, take 1 ounce of bleach, which is about 30 mLs or 30 cc's, and dilute it in 1 quart of water. Asthma can be triggered by animal skin cells, hair, saliva, urine, and feces. Cats, dogs, gerbils, and hamsters are common pets that trigger allergies. Some homes have mice in them, and the mouse droppings can be allergenic. If someone with asthma is found to be allergic to their pet, the best thing they can do is to remove the pet from the household. Easier said than done. Limiting an animal to a certain area in the house is just not as effective. For example, even after a cat has been removed from the home and the home is thoroughly cleaned, it can take months for the level of cat allergens to drop, and therefore months before the asthma symptoms fully resolve. If it's not possible to remove the animal from the household, then one can decrease animal dander exposure by avoiding the pet or keeping it away in a separate area. Also, cleaning the household frequently, avoid touching one's face, and frequently hand washing. With that said, all of these measures are still not as effective as removing the animal from the household. Cockroach and mice droppings contain allergens that have been shown to trigger asthma symptoms in certain people. It's best to remove trash promptly from the home. Wash dishes and cooking utensils immediately after use. Use multiple baited traps or poisons. Remove any cockroach debris quickly and eliminate standing water from leaky faucets or drains. Air filtering devices, including HEPA filters and electrostatic filters, are advertised to reduce indoor allergens. Few have been shown to significantly improve allergy symptoms. Certain types of air filters, such as ionizers, produce ozone, which is a respiratory irritant for some people. These devices have not been shown to be safe or effective and are therefore not recommended. Most air filters probably do remove many allergens from the air. However, if there's a pet, carpeting, furniture, or some other reservoir of allergen in the vicinity, then the allergen is continuously released from these reservoirs as people move around the household. The air filter can't remove all of these allergens, and the benefit of an air filter is minimal. Now, if there is a room where there's no carpets, drapes, upholstered furniture, access to outside air, and pets are not allowed, then running an air filter in this area probably can improve air quality. Also, a vacuum cleaner with a HEPA filter and a double thickness bag can help to reduce allergen levels.